Hello everyone, Dr. Corinne Weaver here. I just wanted to shoot out a little video to you guys on my new book that's coming out. It's called No More Meds. Real excited to get this book into your hands. And if you are a parent right now that's watching and you have sick, sensitive kids, this book was designed specifically for you. I'm going to highlight what I am talking about in the book, and in order to do this, we're going to talk with S. And in my stress-free strategy system, the No More Meds method. All right, and S stands for schedule time to learn why your kid is sick, insensitive. Why are they picky? Why are they not eating certain foods? Why are they getting ear infections all the time? Why does their head hurt? What's going on? Do we have a health care crisis? I'm going to share a story real quick with you. Someone that I met a long time ago, her name was Jamie. She's so sweet. Met her when she was 8.5 years old, and she had an injury just like me. You remember my story? I was 10 years old, riding my brand new pink bicycle, and all of a sudden I fell, right? Busted out my front tooth, and I had that head trauma. People don't understand that after that physical trauma, that's what led to all my health problems. And I was needing to live on a breathing machine. Same thing happened with Jamie. She was normal, 8.5-year-old. Everything was cruising, everything was fine. She fell and hit her head and had a 14-month migraine. 14 months suffering with a migraine. Did not meet me until obviously 14 months, and then I helped her with her migraine. But during that 14-month period, she went to many doctors trying to find answers, and her parents were trying to get her head to get better. Not even the treatment at the hospital where they were doing IV treatment. And her eyes, after the fall, she became very dilated. So we have to schedule some time to learn why our kids are sick. And I'm going to be going over in my book what tests are necessary for that we need to do to find out why our kids are sick, and what therapies work best for our children. And see, what Jamie's parents and what my parents did, they did everything they thought they knew was right, was going to the professionals and trying to get the answers. Unfortunately, when I was having the breathing issues, that's all they knew was to give me medication to help me with my breathing. Well, yes, it got me out of the crisis, but it never really fixed the true cause of why my breathing was bad in the first place. Same thing with Jamie. Jamie was given tons of medication and IV treatments to help her symptom of a migraine. But no one looked back to think maybe that head trauma stirred something up in the nervous system, caused her eyes to be continually be dilated, and her to have this migraine. One day she was sitting at her school and going like this, like she always does with her head, and her teacher was a patient of mine and just said to her, "Jamie, I know you have a really bad migraine. I'm not allowed to do this, but I want to let you know that there's somebody named Dr. Weaver, and she's helped me with migraines, and I'd like to tell your mom about her." Well, that's kind of what happened in the system. And so Jamie came in, and right away I knew what was going on with her nervous system. Her nervous system was fight or flight. So we talk about in the book we have two different nervous systems, a parasympathetic and a sympathetic. Either one, a bear is going to come get us, right? And what are we going to do? We're going to fight and get away as fast as we can. And that's what her body was set on. It was not set on the parasympathetic nervous system that helps you what? Rest and digest, and it helps you with your breathing. So there's some things that you can do right now. Is you can take some time right now to take some deep breaths. Breathe in with me through your nose and out through your nose. You just activated a part of your nervous system that tells your body that you're in a safe, calm place. And what I did with Jamie was not only look for what was causing her migraine, and we did find the cause of that and we corrected that, but I also taught her how to breathe properly so she could retrain her brain and body communication. So again, I want to thank you guys for listening today, and this is the day that the Lord has made. Let us rejoice and be glad in it. We have so much to be thankful for, and I'm so blessed to be able to talk to you today and to help many, many patients get their health back on track. You can get well too, and I hope you have a blessed day.